that those cancers are accounting for 59% of the all cancers that we have worldwide. Cancer has become a great burden. It's like a problem for everyone nationwide, whether in America, in Canada, in Nigeria, in any part of the world it has affected anybody. Next slide, please. Next slide, please. Okay, so you can also see this was 2018. Because of COVID and all, there was not really much studies done in 2020, and I couldn't really get the data on 2019. So in 2018, you could see the global incidence of number of new cancer cases. We had about 18.1 million new cancer cases worldwide. Cancers in America, in Nigeria, in Ghana, worldwide. When they calculated the total number of cancers we've had, we had 18.1 million new cancer cases. Next slide, please. Okay, so we're going to be discussing breast cancer. And as a female, every female has a breast. And then we're going to be discussing breast cancer. I pray that breast cancer will not come near us in Jesus' name. So we're going to be discussing breast cancer. The reason for this is to create a sensitization and a form of awareness for us to understand what breast cancer means. So this is the burden of breast cancer worldwide. You can see that breast cancer is one of the common cancers worldwide. It's accounting for 24.5% of the total amount of cancers that we have worldwide. Now that pie chart is trying to show us how breast cancer is so widely affecting women. It's one of the common cancers and one of the common killers of many women, if not detected early. The next slide, please. So what are the risk factors of breast cancer? What can put you at risk of developing breast cancer? As you advance in age, you can be put at risk of getting breast cancer. The lower aged you are, the more advantage you are of not having breast cancer. Usually children, teenagers are not at risk of getting breast cancer. But as you begin to age, by the age of 20 and above, you see people begin to be at risk of breast cancer. Another thing is reproductive history. Reproductive history in the sense that, do you breastfeed your baby? Usually we found out that mothers who breastfeed their children are at lower risk. That is, they don't get breast cancer easily. So that's why we advise that you breastfeed. It's always good that when you give birth, you breastfeed. Because if you don't breastfeed, you might be putting yourself at a risk of breast cancer. Another thing again is hormones. Some people want to... maybe they are married and they don't want to give birth again, then they begin to use contraceptive. Some of all these drugs that we use, they also put us at risk of breast cancer. These pills that we use for preventing childbirth, it puts us at risk of breast cancer. Another thing again is a previous breast disease. Maybe there was one time that you did not have cancer, but you had something wrong with your breast and you had to see a doctor. You could also be at risk of having breast cancer. Another thing again is family history. So if maybe your grandmother had a breast cancer, that means that there's something we call the BRCA1A gene and the BRCA2A gene. That means that that gene runs in your family. So it puts you at risk of also having breast cancer. So that's why it's important that you ask your family members, your parents, your mother, your grandmother, your great-mother. I want to know what actually happened to them if they are no more alive. Like what killed them? Was it a form of cancer or another thing? I've also spoken about the genetic. Then lifestyle factors. Usually we found out that people who take alcohol, who are obese, who are very fat, who are on the big side, who are not active, who like sitting on one spot, who do not like doing exercise, are usually at risk of having breast cancer. Then radiation exposure. Usually I tell people, except it is needed, don't do any form of x-rays. You don't need to do x-ray. All this, I have cough, I want to do x-ray. Doctor says you should not do x-ray. But you're the one insisting you want to do x-ray. Because when you do a chest x-ray, you're exposing your breast to a form of radiation. So you don't need to do x-rays if they are not needed, but if it is needed, you can do it. Because the number of times you expose yourself to radiation would also put you at risk to breast cancer. I pray it will not come near us in Jesus' name. Next slide, please. Okay, so what are the symptoms of breast cancer? I'm going to be talking about the symptoms of breast cancer. Please, can we hear me? Are we following? Okay. I'm going to be talking about the symptoms of breast cancer. The first thing is lumps. Can we repeat after me? Lumps. Lumps. So if you look at your breast or you check your breast, you examine it and you feel an abnormal mass. An abnormal mass. It's not only in your breast, even in your armpits. If you feel an abnormal mass, please see your doctor immediately. So the first thing is lumps. So we are going to be looking at these symptoms together. The next thing is nipple discharge. Can we repeat after me? Nipple discharge. Nipple discharge. So if you are not breastfeeding, and then you are not married, and you're not doing anything violent with your breast, and then you have an abnormal discharge, you just see this abnormal discharge coming out from your nipple, please see your doctor. It's very important. Don't take it for granted. See your doctor. Another thing again is nipple dimping. Many of us know oranges. You know the way oranges look like, that it's always it has these holes on it. All these oranges are about to spoil, that has this hole on it. If you see your breast is getting that way, is looking that way, is dimpling that way, please see your doctor. Another thing above there again is breast pain, an abnormal breast pain. Your breast is paining you, you have used paracetamol, you still keep feeling this breast pain. Even if it's not on your breast, if it's on your armpits, because the breast and the armpits are very close together, please see your doctor. Don't take it for granted. I believe in prayers, but it's also important that we seek medical care. The other thing again is nipple retraction. Usually for everybody, you expect that we see the nipple. The nipple is outside and not inside. But if you realize that your nipple, you see that it's going inside, please see your doctor. The other thing again is you notice that your nipple is looking red. It's just looking very red. For so many of us that are dark in complexion, you might not see it looking red. You might see it looking darker than normal. So you might not be able to appreciate red on your body, but you see it's looking darker than normal. You also need to see your doctor. The other thing we'll also be talking about is changes in the skin of your breast. So if your breast, if you know the way the skin of your breast is, usually it's soft. But if you notice it's maybe getting harder or getting softer than normal, you are peeling it. You are noticed, even if you see something like little crow, anything, and you want to peel it out, please see your doctor. It's very important. Don't take it for granted. It's important you see the doctor first, and the doctor tells you there's nothing, then you take it for granted. The other thing again is swelling. If you notice your breast is swelling or your armpit is swelling, see your doctor. So can we repeat after me? The first one is lumps. The first one is what? The second one is nipple discharge. I'm not hearing us. The second one is nipple discharge. The third one is nipple thickening. The next one is nipple thickening. I was talking about that part that we say when it looks like orange. It's like dumpling and all. The other one is breast pain. Can we repeat after me? Breast pain. The next one is nipple retraction, when your nipple is going inside. Can we say nipple retraction? The other one is breast redness. And the other one again is swelling in the breast. Then changes in the skin or the texture of the breast. Can we go to the next slide? I'm going to ask us questions, so I hope we know the symptoms of breast cancer. So these are just the symptoms I just tried to write out in bullet points. Can we move to the next slide also? Next slide. Next slide, yes, next slide. We've talked about the symptoms already. Okay, so breast awareness. There's a 5-point breast awareness code that we should know. And the first thing is you should know what is normal for you. You should wake up in the morning, look at your breast and know what is normal. How does your breast look like? Everybody is different. We have different faces. So your breast cannot be like your neighbor's breast. It cannot be like your sister's breast. So know what is normal for you. How does your breast look like normally? The other one is look and feel for any changes. It's important that you look at it in the mirror and you feel it for any changes. I'm going to be teaching us how we are going to be feeling it. The third one is that you know what changes to look for. I spoke about looking for breast lump, breast pain, swelling, the skin changes and all. Then once you see anything, report to your doctor without any delay. Then you should have your routine breast screening from 47 and above. But that's no longer true. You start having your routine breast screening from 20 and above. Please, can we go to the next slide? So this is just what I talked about, risks in breast cancer. That for you to reduce your risks in breast cancer, usually there is no definitive treatment to prevent breast cancer. But you can reduce the risks of getting breast cancer. And some of the things you can do is lifestyle modification. I want to clear our doubts generally. Usually, cancers do not have prevention. You can only reduce the risks of getting cancers. And one of the things you can do is to do a lifestyle changes. One of the first lifestyle changes you want to do is you should maybe, we usually advise that for breast cancer, because the lower age you are, the more advantaged you are of not getting breast cancer. So they usually say you should get married on time. I don't mean when you're still not yet fit for marriage, but once you're at a marriageable age, get married on time and start having children and start breastfeeding. It helps to prevent breast cancer. Not like preventing that time, but reduces the risk, because if you still have the family history, it's still possible you're at risk of getting breast cancer. The other one again is that you should try to reduce your weight. If there's something we call body mass index, there's an appropriate weight that is good for your height. There is an appropriate weight that is good for your height. So if you think that you are getting fat or you are adding weight than you should, please, let's start exercising. I know many of us like to take Uber, like to enter buses. Sometimes if the distance is not far, let's just trek it. It doesn't mean you are suffering. It's part of exercise. So we should also try to watch our weight. I pray God will help us. Another thing again is to avoid oral contraceptives, except that is what is really needed for you at that particular point in time. If we have looked at you and we have assessed you in the hospital and then other things do not seem to work out well for you, you might need to take the oral contraceptive. But if not, please avoid it. I believe we are Christians. The other thing is to avoid alcohol. You shouldn't take alcohol if you don't need to take alcohol. Next slide. Okay, so I've spoken about this. Reduce your weight if you are overweight. Increase your exercise. That's physical activity. Reduce alcohol intake or avoid alcohol. Avoid oral contraceptive where it's possible. Then have children at a younger age and start breastfeeding. That's the primary prevention of cancer. Those are the things we can do as human beings. The other ones we can do is to pray. It's not as if these things can remove cancer from your body. But you can do all these things. It reduces your risks of having cancer. The other thing you can do is to pray about it. The next slide, please. So this is still the primary prevention, because when we are talking about prevention of cancer, we talk about it in two stages. The primary prevention, that you don't have anything at all. What are the things you can do to prevent you from having cancer? That's the primary prevention. The secondary prevention is what I'm going to be talking about. Next slide, please. Next slide, please. Okay, so we're going to be talking about the secondary prevention. This is the part where every one of us, apart from you are eating healthy, you are doing exercise, the other thing again is for us to have, to screen ourselves and then to see our doctors. Next slide, please. So how do we screen ourselves? The first one is self-breast examination. Can we say after me, self-breast examination? That means you are examining your breast by yourself. Self-breast examination. The other one is clinical breast examination. That's the one the doctor will do for you. And the other ones, I'm going to be explaining them to us later. Next slide, please. Okay, so self-breast examination. I'm going to be explaining to us how to do a self-breast examination. Usually, if you want to do a self-breast examination, you do it about 2 to 3 days or 3 to 5 days after your monthly period. Because it is believed that once you are having your period, your breast would have some changes, or when you are ovulating, your breast will have some changes. So don't do it that period, because your body thinks you might get pregnant the next month. So once you're on your period, your breast will start getting fuller and all. So you might not be able to know what to feel for. But once you do it 2 to 3 days after your menstrual period for you. So I'm going to be calling someone out and I'm going to be using it to explain to us how to do a routine breast examination. But the first instance, the first slide there says once a month, 2 to 3 days after your period. Then the first thing you do is you stand in front of your mirror. I believe we have mirrors. At least we have mirrors to do our makeup. So we should have mirrors to look at our breast. After having your bath, you stand in the mirror. And then once you stand, you use if you're examining your left breast, you use your right hand. Did we get that? Can we repeat after me? If you're examining your left breast, what hand do you use? If you're examining your right breast, what hand do you use? Okay, very good. So you stand in front of your mirror and you use the other hand to examine the breast you want to examine. And then what we do usually as doctors is we divide the breast into 4 areas. We call it first quadrant, second quadrant, third quadrant, and the fourth quadrant. So you examine. I'm going to demonstrate first. I'm going to say someone should please come out and we are going to demonstrate it. So you feel for lumps and you feel for any abnormal growth. So can someone come out while I try to demonstrate how? Problem. And then I'm going to call someone else. Someone else to come and practice. So what I'm saying is, can we see her? Okay, can we see her? Can we all see her? Okay, so this is what we are going to do. It's just an imaginary division. It's not as if you divide it. So this is... So... Okay. Okay, so praise God. So you divide it into 4. So this is our right breast, right? So I'm going to be using my left hand. Ideally, I should use my left hand and stand on this side. Can we see me? So you divide it into 4. This is one division, then this is the other division for the first breast. Did we see that? So you just draw 1, 2. Did we see that? 1, 2. So this is the first quadrant, the second quadrant, the third quadrant, and the fourth quadrant. So what you use is the palm of your hand, this palm. That's what you use to feel it. So you just do this, you do this, you go down, then you go down. Then the fifth quadrant is your nipple area. You use your this thing to just feel your nipple area. Did we get that? Then afterwards, you can then touch by your hand and then just feel if you see any abnormal thing. If you are not sure what you are feeling, it's not wrong to go and see a doctor. Not a doctor who is interested in seducing you, but a proper doctor to help you examine, just for routine examinations. Can somebody come and try the breast? Then afterwards, sorry, I forgot, you also examine your armpit. Because the armpit and the breast are very close. The blood that supplies the arteries that supply the breast are also the ones that supply the armpit. I've seen people who will tell you, okay. Okay, should we run through the examination again? Okay, so I said we are going to divide into 4 quadrants. This is 1, 2. This is the first quadrant, the second, the third, and the fourth. You are going to use the palm of your hand. So you feel this way, you feel this way, you feel this way, you feel this way. Then the last place you are going to feel is your nipple area. After feeling your nipple area, you also feel your armpits. It's important that you feel your armpits. Usually people would say, what happened is it only started with my armpit, nothing happened to my breast. If it's on the armpit, it's important that you still see a doctor, because some things can happen to the armpit and it's meaning something is happening to the brain, because the artery that supplies the breast is also what supplies the armpit. So we don't joke with the 2 areas. They are very close alike. In fact, if we see like an abnormal growth around the armpit, we usually will send it to the lab to be sure it's not a cancer or not. So please, if you feel your breast, feel your armpit. It's very important. Can somebody come and try? Anybody? No, not you, someone else. Okay, you can come forward. Okay. Come and touch. Oh yeah, examine your right breast. What hand are you going to use? Okay.
So I'm going to use my palm, according to what she said. I'm going to divide the breast into 4. 1, 2. So the first quadrant, I'm going to use my palm to feel the first quadrant here. 1, 2. No, more feel here. 2, 3, 4. Don't mind it, it's full, so it's joining together. Don't mind it. When we'll do it very well. So then the nipple, the 5th one. Here, feel the nipple. Then you check your armpit too.
Then overall, you can just check your breast. You can just feel manually for your breast. Please, can we give her a round of applause? Okay, sorry, let's give her a round of applause. I'm sorry. Okay, so next slide, please. Okay, this is what a doctor does for you. If you say you have a lump, you feel a lump in your breast. If they've examined you and then they actually see that there's a lump in the breast, they will tell you to put your breast in between that machine, and then it's going to produce this film, like an X-ray film. So you're going to look at the breast and we are going to see any abnormal changes. I'm just putting this so that in case somebody might need to do a mammogram, they don't get surprised. Next slide. Okay, so what are the benefits of screening yourself for breast cancer? It's early detection. If you detect cancer early enough, trust me, nothing will happen. I have a very close family friend. She detected the cancer at a very early stage. In fact, she did the surgery somewhere around the Lhasa, not too far actually. And trust me, she's about 60 plus. She did it when she was like 40-something years old. And she's still alive. You won't even know anything ever happened to her. So early detection is what is important. Once you detect it early, even get to the point of all this chemo and the rest. Because you will, if it's a lump, it will be fine. In fact, one of my colleagues just 2 weeks ago felt a lump, and we also did the surgery for her. Don't think you are disturbing any doctor. It's better to disturb than to say, I thought it was nothing. Once you feel anything, please see your doctor. Then it also reduces the, so a lot of people die of cancer. And this cervical cancer. Okay, it's also called cancer of the cervix. So familiar with the cervix. So that's why I put in a picture to show us a normal cervix. So this is a normal cervix. Now you can see the part above is the womb. This part above is the womb. Then this tiny part below, this broad part below, the pink part below is the vagina. We all know about vagina. And then the part between, before you get to the womb, and between your vagina and your womb is the cervix. It's like a narrow passage. It's a very narrow passage. So that is the cervix. If we still don't understand, this also, the other slide is showing us like if you divide a person into two, a cross section of a person, that is the womb, that is the cervix, just a small passage, and that is the vagina, just a very tiny passage. You can just imagine an abnormal cell growing there. The cancer can be very terrible. Next slide, please. So this is still a normal. Sleeping with a man direction. Then if you have a family history of cervical cancer, let's say your grandmother, your mother has had cervical cancer, it puts you at risk. Then uncircumcised male partners, use of contraceptive for a long time, even with a cervical cancer patient, like sometimes can put you at risk. Next slide, please. This is still the risk factors. I just put it in this diagram. Next slide. Okay, so what are the symptoms of cervical cancer? So that's why it's important that you check yourself. Usually when you have an abnormal vaginal discharge, many of us know how many days we used to menstruate. Some people use 5 days. Some people use 3 days. Some people use 7 days. You know the number of days you used to menstruate. So if you are bleeding for more than those days, let's assume usually we use 3 days. And now you see that your period is lasting about 7 days. Please see your doctor. It doesn't mean you have cervical cancer, but just to be on the safe. Then if you are having this abnormal, time you meet with your husband, you have this severe pain, please see your doctor. Then if you notice that you're just losing weight, unexplained weight loss, you can't explain. But that's not the only thing that causes unexplained weight loss. It's just one of the risk factors. You can also visit your doctor to be screened for cervical cancer. Another thing again is continuous back pain, leg pain. It doesn't mean that everybody with back pain has cervical cancer. I'm just saying that it's one of the risk factors. Sometimes to the kind of job you do, if you are doing a job that you always have to bend down, your back will pain you. So it can put you at risk of cervical cancer. Next slide. Next slide. Okay, then also unexplained, very painful menstruation. I know that many females have menstrual pain, but if you just keep seeing that this menstrual pain is so severe, it's not as bad as the way it used to be before. It's now more severe than before, and it's getting worse with every month. You also need to see your doctor. These are just the 10 danger signs you need to look for. Abnormal vaginal discharge, heavier and longer menstrual pain. If you have pain, although that's not a classic sign, but sometimes you might need to be screened. You are losing weight, you are getting tired easily, back pain, leg pain. Next slide, this is just what I just spoke about. So this is the virus I talked about. Can anybody try to pronounce it? Please let's give ourselves a round of applause. Human papilloma virus, just like COVID-19 virus, that is coronavirus. So human papilloma virus, as Small as it look, it's very destructive, just like COVID. Usually, viruses are more destructive even than bacteria because they do it more harm than good. So next slide. So what is human papilloma virus? It's a virus that has been found to be infected in many women and also can be transmitted in men. Usually it is sexually transmitted. Most time it's sexually transmitted. And then it's found in many cancers. It's not only found in cervical cancer. You can find it in... Now, you know the bad thing about cancer is that cancer has been found to affect almost every part of the body. You know, we have blood cancer, we have leg cancer, we have cancer of the eye, we have of the ear, we have different... Every part of the body, cancer can affect it. You know, we said cancer is just an abnormal growth. So this human papilloma virus is sexually transmitted. That's why I was talking about once a prostitute can be at risk of having human papilloma virus. And is the underlying cause of cervical cancer since 1996. They found out that many people who have human papilloma virus have cervical cancer. It's also found in other cancer like vaginal, the anus, the mouth. Sometimes it can be the one that affects the mouth because people do all manners of things sexually, so they could have human papilloma cancer transmitted orally. Next slide. Okay, so to be screened for cervical cancer, you know the breast cancer, it's not like they are doing anything to your body. It's you that are just touching yourself. It's not like it's painful. It's not painful. This is not painful, but this can be a bit more discomforting than the touching of your breast. So what happens is you'll be told to go to the hospital. So usually I advise that pap smear is done for anyone that is sexually active. That is, once you're a married woman, please, you should have a pap smear done. Once you're a married woman, have a pap smear done. Or you're sexually active, you should have a pap smear done. What happens is they'll put in something inside your vagina and then it will get to your cervix. And then they'll put in a brush and then they'll clean that area. And we'll put the brush and look at it to be sure that there is no virus there. Next slide. So the screening can first be done 3 years after your first sexual intercourse. Can we repeat after me? 3 years after the first intercourse. Are we tired? 3 years after the first intercourse. Then we can then start to be screening every 3 normal results. We can then go every 3 years. Usually we'll tell people to stop at about age 65 to 70 until, if they have a negative result. But you still need to be going every year for checkup. Next slide. So the good thing about the human papilloma virus is just the way COVID-19 has a vaccine. It also has a vaccine. And I'm sure many of us don't know about the vaccine. So this is important to vaccinate every woman between the age, or every girl between the age of 9 years old and 26 years old. Whether they are sexually active, they should get the vaccine. So for those of us who have given birth, we have children within this age, it's important that they get this vaccine. It's not recommended for people above the age of 26, people who are pregnant, people who are breastfeeding. It's not recommended for men. The men do not need it. They don't have a cervix. Next slide. So the vaccine is usually more effective before they have a sexual activity. So if you have a child who is 9 years old, or children who are not yet sexually active, it's even important that they get the vaccine. When I was in school, my consultant used to tell us that many of us will ask for our parents' gift of a new phone. But you can ask them for this vaccine. It's a birthday gift. They can give it to you. It's quite expensive, but rather than buying a new phone, you can tell them to give you a vaccine. So you don't need to do the HPV test for young people before you get the vaccine. Next slide. Okay, so this conclusion, usually I forgot to say that the vaccine is not a treatment for the cancer. It's just a means of prevention. I pray God will help us all in Jesus' name. In conclusion, cancers are real. The knowledge of it is important. Remember, the Bible says that my people perish for lack of knowledge. God is still in the business of doing miracles. Miracles are not old schools or Bible stories. Next slide. Thank you.
Thank you so much, Dr. Femi. We really appreciate you. Do you have questions before we finally pray and go? Any question for her? They did International Women's Day in my office, and they said that papilloma, what did you call it?